Hey everybody, it's Dr. May. How's it going today? Hope you guys are doing good. So I'm here today to do the third part of my four-part attachment series. So today we're going to focus on anxious-avoidant attachment, which in adulthood is called dismissive attachment. Okay, and we'll get the screen up for us. Okay, almost. There we go. All right. So anxious-avoidant or dismissive attachment. All right. So quick review. All right, so what is attachment? So attachment in this context refers to the bond between a caregiver and a baby. And that bond and that interaction between, let's say, the mother and the baby kind of forms our, sense of connection and the way we relate to people. It kind of inserts almost like a template within us that we then take into future relationships. And it informs the way we feel about ourselves and the way we see others. And in a way, I forgot to mention this in the outline, it's kind of like a procedural memory. And that's the kind of memory that's deeply unconscious. And we show the memory by our actions now, right? So like riding a bicycle is also procedural memory. It's hard to put into words what we're actually doing, but we know how to do it. Just like when we meet somebody, we kind of fall into step with a certain kind of relationship pattern, right? So that was all formed really early on in our, parent-child relationship. Okay, so the type of attachment we form is based on our appraisal of how sensitive the parent is to our needs and how responsive they are to our needs and our emotions and our, our care, right? And our attachment styles when we get older are still relevant, and we might have a different attachment style with different people, or we might have one predominant attachment style, but it also can change. So if you have an attachment style that's one of the insecure ones, kind of like the one we're talking about today, you could also work toward becoming more secure. And they call that earned secure. All right, so that's the good news. It's possible to change and get better. All right. All right, so quick review of the 4 attachment styles. So far in my other 2 videos, we talked about secure attachment and anxious ambivalent attachment. So today we're going to focus on anxious avoidant attachment or dismissing. Okay, so if you look at the poles here, the axes, so they're low proximity seeking, which means that they don't really seek out people so much, and also have a low anxiety of abandonment. So if someone leaves, they're less concerned about it, at least on a conscious level, okay? All right, so in a nutshell, insecure attachment styles in general are not like secure attachment styles because there's more of a fragmentation. Kind of like if you look at that picture, there's kind of a rift. There's some things that are allowed and some things that are not allowed, right? So there's certain parts of me that my parent was accepting of and validating of, and then other parts that I had to push aside in order to maintain the attachment relationship. So in adulthood, I also end up being kind of fragmented as well, okay? So we're gonna talk about which parts had to be fractioned off in, anxious avoidant attachment, okay? All right, so let's start with the parents, okay? So avoidant or dismissing parents tended to be invalidating of their child's needs and emotions, okay? So if a child came to the parent, anxious or angry or upset or hungry or, needing of care or needing of attention, the parent may have invalidated it in some form, okay? So they may have just dismissed it or not cared about it or made the child feel foolish for reaching out, may have ridiculed them in some way. So it makes the child feel like, wow, it's not worth it for me to reach out because it's just going to make me feel bad. Having needs isn't really allowed here. Or, reaching out for support, it's not really allowed here. So I have to figure out how to handle that without my caregiver because they're not going to be the ones to help me. Okay. And that's kind of sad if you think about it because kids really need their caregiver to help regulate them, right? It's part of the co-regulation that's supposed to happen between caregiver and child, right? So in general, the caregiver is then perceived as being unavailable, especially on an emotional level, maybe disengaged or even rejecting. And sometimes the kids are just left alone too much. Like there's maybe not enough felt attention that's given, okay? So if you look at these pictures, it kind of tries to illustrate that a little bit. Okay, but when there is attention, it's kind of selective, right? So let's say the parent's okay with providing in a physical way, right? We put food on the table, you know, you have all the toys you need, right? We take you to sports, don't we? Right? But maybe there's just not that love there. There's not that, you know, cuddly, cozy, snuggly kind of parenting going on, right? So some needs are okay, but some needs are not okay. My need to achieve might be okay. They might be very gung-ho about me getting good grades or being a good athlete or something like that, right? But so then I try to be who my parents want me to be so that they still love me, right? So I guess I'm going to have to be really good at soccer because that's what my dad really wants for me, right? He doesn't really care about my feelings. He doesn't really care about, you know, my anxieties. But if I'm good at soccer, he gives me attention. So I guess I'm just going to try to be good at soccer, right? So that's kind of how this part works. Okay, so again, you kind of start to make the conclusion that it's not worth reaching out to other people. Even though deep down, you still would want that, based on your early experiences, it feels like it just wasn't worth it. It was too hurtful. It was too invalidating. So you kind of make the choice unconsciously to just be more autonomous, just be more independent. I'm just going to do this myself and not bother with other people. Okay. So there's a sense of premature autonomy that develops in the child and premature self-sufficiency, right? So is it more of a focus on the self and taking care of myself than worrying about getting the care from other people. And I might even dismiss others because I just feel like, what's the point, right? So when you secure attachment, you could have focus on attachment and focus on exploration of your environment, right? Both are okay. But here, the attachment part is kind of shoved aside. You have to split that off and just focus on exploring and doing your own thing. So maybe you'll be really into your Legos or your toys and doing stuff like that. But you know, forget about these relationships with my parents, you know, or other people for that matter later on, right? And my self-esteem, therefore, is not based on how much people love me because I'm not really feeling the love as much. So it's more based on my performance. And that's what I'm getting reinforced for anyway, right? I feel good when I get good grades. I feel good when I do good in soccer. I feel good when I do well with my instrument or whatever I'm doing to play, right? So that's what gets me my self-esteem. It's not based on relationship. Okay, so as you could probably tell, there's a splitting off of emotions, right? So what's the point of me feeling emotions if nobody's there to validate them, right? Or if I'm just going to get, you know, dismissed, or I'm just going to be made fun of or told, you know, stop crying, right? So I kind of train myself to cut off my emotions. I avoid emotions in myself, and I'm not very comfortable with emotions in other people either, okay? When I'm stressed out, I'm actually hypo-aroused more than hyper-aroused. So I might go more into a shutdown mode rather than a sympathetic arousal kind of a mode, okay? So you can deal, but you can't feel, right? So you could superficially look like you're just getting through situations, you're coping fine, nothing's really bothering you or getting to you too much. So you're dealing with it, but you're cut off from your emotions, right? So you may not feel too much. And that's the sad part, right? Because it's important to have access to our emotions. However, they do say that anger is something that you're a little bit more in touch with because anger creates distance, right? Anger tends to push people away, right? If I start yelling and screaming at you, you're probably gonna be like, whoa, right? So it's okay to be angry because that just gets rid of the people that are gonna bother me anyway, okay? And again, I prefer auto-regulation, just dealing with my own self, regulating my own emotions, and not reaching out to others for co-regulation. Because I don't really believe it's gonna happen anyway. I don't want people to support me, forget that. I'm just gonna like find my own way out of this, okay? All right, so as you also probably could guess by now, there's a mind-body disconnect, okay? So I'm much more in my head if I'm avoiding dismissing, and much more cut off from my body, which also tends to express my emotions, right? Because you feel your emotions physically. So I'm not really in tune with the messages that my body could be telling me, right? If anything, I'm just focused on the superficial aspects of my physical appearance, or, you know, like my working out, building big muscles if I'm a guy, let's say, or maybe a girl too, you know, depending on the person. Maybe I'm really into makeup or style, or I'm getting some plastic surgery done because I had to look just right. Like all that kind of stuff is more of the superficial attention to the body. but it's not that like, okay, I'm tuning in to tell what I'm feeling, or I'm noticing the areas of tension and I'm trying to loosen them up, or I'm mindfully, exploring what's going on in my body. Like that's like, not really happening so much. Okay. Um, so this is more of a reasonable mind kind of a person, right? I'm much more up here. I'm much more in my head. I'm wrapped up in my thoughts. Maybe I'm obsessing about things a lot, and that kind of keeps me disconnected. So is more intellectualization. So that's more where I'm at. It's not like that kind of integrated mind body thing. All right. Okay. So relationships. When people who are avoidant dismissing partner up, they tend to partner with anxious, ambivalent people or preoccupied people. So it becomes like this pursuer-distancer pattern, okay? So if you look at the bottom right, it says anxious partner and avoidant partner. So the anxious partner is chasing and the avoidant partner is running away. So the anxious partner is like, please don't leave me. Please stay with me. Please give me more attention. The avoidant partner is like, whoa, whoa, too much, too much, too much, right? Too close, too emotional. I can't take it. Right? So the anxious partner keeps pursuing and the avoidant partner keeps distancing. And it just becomes the more, right? It gets more and more of a cycle. So I found this little diagram on the left that kind of fleshes out the cycle a little bit more. So let's say, okay, starting on the upper right of the left diagram. So the anxious person gets close, right? Oh, honey, let's get close. Da, da, da. And the avoidant's like, whoa, whoa, too much. The avoidant runs away. Then sometimes the anxious person doesn't like that they're pulling away because they're afraid of abandonment. So the anxious person starts provoking them into a fight so they can reconnect in a way. So avoidant people don't like conflict. It freaks them out. So they just stonewall and distance themselves. Nothing ever really gets resolved, right? There's no really reconciliation. There's no really working through that or anything like that. Eventually they just kind of reconnect again, right? But when the reconnection gets too intense, the cycle starts again. Okay, so that's often what happens in a partnership. But in their friendships, it might be also a little bit more superficial. Might be like you're not really revealing a lot about yourself. Maybe you're talking about more superficial topics or keeping it on the like a casual level. Maybe we're just talking about sports or we're just talking about work. I'm not really talking about my deep concerns or thoughts or feelings so much, right? I'm talking about what's on my phone, not on my mind. Okay. Yeah, that's basically most of this. Sorry, I'm talking, I'm not really looking at what I wrote, but I guess another thing to add is because people weren't really, let's say, attentive to my nonverbals or attentive to my emotions, right? It's hard for me to recognize it in other people too, right? Because I needed someone to mirror it in me for me to fully understand it and want to see it and believe it's okay to experience it. And then when I feel okay with it, I could then notice emotions in other people. But if looking into the eyes of other people just is going to show me rejection, why would I even want to look, right? Or if I look to someone else for my emotional reaction to mirror it back to me, and I just see invalidation, I just stop looking, right? So I don't really attend to nonverbal cues in other people very much, right? Or I don't really tend to their emotions because in the past, that just led to more hurt on my part. Okay, does that make sense? I feel like I'm babbling a little bit. Sometimes it's hard to get the words out just the right way, but I hope that kind of makes sense. All right. Okay. Okay. So there's two basic models of self and other, and it might sound a little familiar because it's kind of a narcissistic model. Okay, because a lot of people with avoidant attachment are kind of on the narcissistic end to one degree or another. Okay, so on the one hand, you might see yourself as being strong, right? I'm strong and autonomous and independent, and I can handle things myself, and I don't need you people, right? And so I devalue other people. I say, well, these people are flawed and weak, and I might be condescending or critical or things like that, right? Devaluing. I might be trying to dominate people or be in control or show people how much I'm achieving, and therefore I'm superior in some way or special in some way. Okay. There's a false distinctiveness bias where I feel like I'm different and special, right? I'm not like other people. Like the anxious ambivalent over assumes that people are like you, right? I kind of assume more similarity than there is. This is the opposite. I assume more difference than there is. I think I'm much different from you and also superior. Okay. On the other side, the other model is the self is weak and vulnerable and others are threatening. So that's usually what happened when you were a kid, right? Your parents invalidated you. They were threatening to your sense of self. They didn't want to hear about your emotions and your needs. And you felt much smaller, right? So if it goes back and forth, like if I don't stay in the superior mode, I'm just going to flip right back to being flawed and weak and vulnerable. And that feels kind of crappy, right? So I'm afraid of being in relationships that's going to bring out my vulnerability because it was associated with so much hurt in the past. Okay. And I might get really angry if someone pokes at my vulnerability because it's like a defense mechanism because I'm afraid of, that being exposed. Okay. So I might also avoid it by just trying to be who people want me to be or blend in or come up with a superficial cover just to like get by so people don't poke at me. Okay. Okay. Brain-wise. Okay. So there's kind of a cognitive rigidity and they kind of nickname it like neural cement. Okay. So how does this rigidity work? So you're much more left-brained than right brain. So right brain is think about like a little bit more emotional, a little bit more in touch with your feelings. Left brain is much more intellectualized, much more reasonable mind. Okay. There's also this rigidity where your thinking is very inflexible. You might automatically jump to a no before you even fully process the question. You tend to be argumentative, which is kind of like rigidly holding on to your point and trying to put it out there. You might tend to be oppositional, defensive, okay, and not very open to learning or change, right? If you hold your opinions very strongly and people try to influence you, you may not accept their influence. You might push them away and just keep insisting you're right, okay? So that's kind of, think about it, that could kind of get in the way of relationships. And also, even things like being at work, right? You got to be flexible. You got to listen to people. You got to work with people, right? If you're too rigid about what you think and also try to dominate with what you think, not always the best move, right? Okay. Okay, here's another interesting tidbit. So there's a thing called the adult attachment inventory. And it's sort of like a structured interview that they give people. And based on how people respond to the questions, they could kind of tell what attachment style you have. So they ask you questions about earlier attachment experiences in your life, and they ask you to discuss it in different ways, right? So people who are avoidant tend to provide brief responses. They're not big talkers here. So when it comes to accessing these autobiographical memories, which have some emotions tied into it, they don't feel like they have a lot to say. In fact, they often say they don't remember that much. And they might idealize their childhood and say, yeah, we had a great family life. I had the best idealized thing. Or, I went to a great school. I had good parents. But when asked for details, they don't have a lot to say, right? It's hard to back up their statements. And they tend to not even want to touch into the past very much. They prefer to talk about the future because the future is more optimistic. I just try to stay positive and I don't really want to dig down into these older emotions, right? Because it's painful, okay? They also might get kind of bland, and even in terms of facial expression, they may not even have a lot of emotion on their face when they're talking because they're cut off from the emotions of talking about their childhood, right? Okay. Oh, actually, another thing is sometimes they say things as if the other person understands without taking the other person into account that they don't already know them. They don't already know their history. Like if I referred to my Aunt Martha as if you already know her, I'm not taking into account that you've never heard about her before. Okay. It reminds me sometimes like people like to throw around abbreviations. Like there's a million abbreviations in the world of all different kinds of things, right? But they don't keep in mind that not everybody knows those abbreviations. So they do it in a way to try to sound superior, like, oh, you don't know that? I know that. Or shouldn't you know that? You should know that, right? A little bit of a narcissism thing too. Like if I were to say, well, just use Dear Man, and you never were in DBT before, it makes me sound like, oh, look how much I know about Dear Man and you don't. Or it looks like, well, what's the matter with you? How flawed you are that you don't know about this, right? So they kind of pull this stuff a lot too. Okay, so just kind of wrapping this up with some common diagnoses. So now that we went through all this, right, these diagnoses kind of make sense, right? So OCD is a common diagnosis for avoidant dismissing. So think about it, OCD, very intellectualized, focused in your head, connected to your rituals rather than to people much more, right? So you're connected to your thoughts, you're connected to your rituals, not as connected to other people, because it's safer to think. It's safer to do these behaviors, right? Same kind of thing with anorexia, okay? You're connected with rituals around eating. You're over-focused on obsessing about body weight and body shape and pounds and feeling fat, feeling thin. Emotions are kind of narrowed down to a fat day and a thin day rather than the complexity of emotions, right? So more in your head with that as well. Schizoid, kind of like the diagram shows, is when you're not particularly interested in other people, right? Just like there's a kind of a cutoff of a relationship interest with avoiding dismissing because of past experience. And of course, like we were saying before, narcissism, okay? So that's that kind of, grandiose, inferior, vulnerable split, right? Okay, so you're avoiding dismissing. What are some tips for moving towards secure attachment? Okay, well, we'll go over a few, okay? One, in the past, your needs and vulnerability and wish to connect were all invalidated by your parents, right? And that was a painful experience. But now, you could still practice accepting and validating your own needs, your own emotions, your own desire to connect with people, which are still deep down in there. Even if you try to avoid them, it doesn't mean they went away. But if you're willing to slowly get it back in touch with them and show them acceptance and try to meet your own needs, that's a great step, okay? Practicing mindfulness, because mindfulness is good for like everything. It helps you to get back in touch with the sensations of your body and get back in touch with your emotions, to have more of a reflective stance. Whereas before, you were kind of cutting off your body, you weren't very self-reflective, you didn't really want to touch with emotions, right? So this is a great technique for getting back that stuff and bringing it back into the fold, okay? Getting involved with healthy people who are able to model secure attachment and who can maybe give you corrective experiences of being seen, validated, and understood. So maybe, you've never gotten that much from your caregivers and you're not even sure if it's possible, but maybe there's people who will do that for you and you could learn to take that in. It could even be a therapist, it could be a friend, it could be a partner, okay? There we go. There's one thing they call a kind eyes exercise, right? So if you imagine somebody looking at you with really kind eyes and taking that in, the fact that someone's really seeing you as a whole person who has feelings and needs and wishes and, desires, and the person's looking at you kindly with acceptance, and feeling that is a great step, because that may never have happened before. But even through your imagination, practicing taking that in could be a really helpful experience, okay? And related to that, you may not have felt that your parents truly welcomed you into the world. Like they weren't fully embracing of you, like all of you, maybe just certain aspects of you, like your achievement or physical needs or whatever. So what if someone truly welcomed you as a whole person into the world? You were being born and you're coming into this world, and what would your welcome to the world party be? And who would be there? And how would they welcome you? Okay? So feeling like you as a whole person could belong can be a great exercise too. Okay, and I think that's it. All right, so I hope you feel much more enlightened about avoiding attachment now. Maybe it reminds you of yourself or some people you know, and you have a couple ideas about how to move towards secure. Okay, so thanks for listening and tuning in, and see you soon. Bye, guys.